Assalamu alaikum. If you allow me, I'll be presenting this presentation, and I'll outline the needed components for building an effective management system for medical devices. So I will go through different components, and it will be around ranging from need assessment to procurement to staff development, and it goes further to linking the whole process from policy, HTA, and then management. And then, of course, will be the regulations. Before we go along with the presentation, there are a few terms and definitions that I will be elaborating on. So all we have a common vocabulary understanding of those terms. As already mentioned by Adham on health technology. So health technology, as defined in the World Health Organization in 2007, it was saying that it's the application of organized knowledge and skills in the form of devices, medicine, vaccines, procedure, and system developed to solve a health problem and improve quality of lives. So going from there, we move on. What do we mean by devices? So devices, they are tools, instrument, machines that are used in the diagnostic, therapy, monitoring, rehabilitation of care. So by saying that, the medical equipment, it's actually a device. However, it requires calibration, installation, repair, and definitely user training. The ones who are going to install those machines are usually managed or called by medical engineers or clinical engineers. And usually the medical equipment could be standalone, or they come in combination with other pieces of equipment. Could be software, consumables, all those kind of instruments. So those definitions, as we go further with the presentations, it's important that you know and you understand, because whenever we use those terms, you can really recognize what we mean around those terms. Then we have what we call the clinical engineer. And as defined, the clinical engineer is a professional who supports and advances patient care by applying engineering and managerial skills to healthcare technology. And then we had the term that we called clinical engineering or biomedical equipment system. Those system, it's important that while talking about, also mentioned in terms of the HTA, it's how can we be able to reduce cost and improve the quality and the services provided to patients. So those systems, they have to ensure the cost effectiveness of that system functioning to ensure that all program running for the managed equipment is fully supported, and there are procedures and policies that guide any activities related to the medical equipment. While talking about medical devices or health technology, the important component to understand that the aim is to set up and develop systems that promote the safe use of medical devices in the healthcare setting. So having said that, we have what we call the health system. So any strong health system is built on 6 building blocks. One of those building blocks, let me see the pointer. One of those building blocks is, as you see, is technologies. So this building blocks, as you can see, it has multiple relationships and interaction between each other. So definitely each of those have his own challenges and obstacles, but definitely as they interact with each other, we'll have more improved health system. So definitely while we are talking about HTM, health technology management, we are ensuring that whatever support efforts are done in this area, we're ensuring that the services also connected to the other building blocks will ensure that whatever services provided to the patient is to high quality. To be able to ensure good management of medical devices, we follow what we call the phases of medical devices. Those 4 phases start by the research and innovation, and then we have seen the health technology assessment, HTA, which is, as Adham said, is a tool that we can use for decision making. And then you move to the regulation, will be addressed in the coming days in this workshop or meeting. And then we have what we call the HTA, the health technology management. And this part I'll be elaborating more on it in a few minutes. And differently, we have what Adriana already mentioned, the policies, to ensure that whatever actions we are taking are documented and addressing the needs to ensure the high quality of services provided. And definitely for all this to happen, we need the human resources. So it's you who are going to implement those different kind of components. When we talk about HTM, you will see the linkage between the HTA, where decision is taken, and then it goes to the HTA to ensure that whatever action is taken, that we ensure that those priority is based on evidence-based data. So for us to take a decision to procure a type of equipment, we have to ensure that we have a valid need assessment process done. This could be on different inputs which you have to look into that. Some of those could be on burden of disease in your own country, could be on international standards or regulations available that you can be relying on to ensure that whatever decision is taken is on evidence-based data. And then definitely the process goes further by the procurement, and this is also a different, another component which requires skills and technical knowledge in this area to ensure that you have the right people to make the right decision, and to ensure that while talking this area, particularly in procurement, there are different stakeholders involved in this area. One of those are particularly the manufacturers or the sole agent or the companies in your country. So definitely you would like to have a good relation with those companies, because at the end of the day, there's kind of vice versa or mutual benefits between the people who need the services and the service provider, or the people who are giving those kind of equipment. So want to ensure that you build a kind of trust and ensure mutual benefit, that at the end of the day, whatever equipment is procured, you ensure the potential use throughout the full life cycle of those equipment. And then you have the installation, and then you see the linkage between the HTM and the regulations when it comes that after installation and commissioning, you ensure that there's user training done, and any adverse incidents taking place is being reported back, so that the regulation can tackle those issues and by doing the post-market and ensure that whatever equipment is on the market is of high quality, and there's no, or minimize the risk coming out of those equipment. And then at the end you have, once the equipment, the full cycle, or you want to manage the waste of those equipment. So, so for us to build an effective system, you've seen different components. First, about the human resources. You need to have the skilled people available in place who can run such system. So as I have seen through the 4 phases of medical devices, so definitely you need for each phase, you have the required skill needed to ensure that you have the right people running that system. So then you do your assessment and planning, and then you start by development, any procedures or standards you need, and then you go into implementation. So while talking about assessment and planning, definitely it will involve first to write down your scope of service. So if you are tackling a hospital or a district or regional or even at the ministry level, then you have to ensure that your scope of service is defined, and then you put your structure, and accordingly you can look for the staff that you need to implement and do the job needed. So then it comes to the training need to ensure that you have the required skills available, and then you look for the tools and software or system that help you to implement those kind of services. So definitely in terms of the maintenance, You will need for sure what we call the computerized management maintenance system to ensure that all your data, particularly for the repair management, are recorded in one system, that you are able then to ensure that this piece of equipment is monitored and maintained through the potential whole life cycle of the equipment. And definitely you need kind of procedure and systems in place to ensure that whatever you are doing is documented, and then you can develop further and improve your implementation. So while talking about the health technology management, the first thing is to say what I'm going to manage is particularly assets. So we have medical devices, they are assets at the hospital. So in one hospital you can kind of have, you might have kind of 5,000 pieces of equipment, or some others might have less. So definitely to manage all those equipment, you have to put classification criteria to do that. Some of those criteria could be based on the risk level. So while looking into that, there's kind of international standards from the US, what we call ECRI. They have proposed this kind of risk level by 3 different levels: is high, medium, and low. Definitely, these levels depend on the risk of injury caused by the equipment failure or user fault. So while having those kind of risk, then you can decide on the equipment you need to manage. So particularly for specialized hospitals, they might recognize few items that they do have kind of high demanding and use on daily basis. So they have to maintain those equipment and ensure the functionality of those equipment. So definitely it will also depend on the mission and scope of the service you are providing. But those could be kind of criteria to assist you to classify and agree, particularly for those hospitals or countries or systems that they don't have kind of system in place. So to start from scratch, they need to start step by step, looking at how easy to start by doing that. So maybe at first level to consider the high risk equipment, to ensure whatever high risk equipment is available in your hospital, in your country, those are monitored and those are captured in your database, and you are able to ensure their functionality, at least to minimize any risk or any risk to the patient by using those kind of equipment. So when you have those kind of classifications, then you can do your inventory. Once you do your inventory, you ensure that those items are in your inventory, so that you are able then at later stage to put a preventive plan for them. Because as we say, that to ensure that you have the maximum benefit of those equipment in your hospital and to ensure they are the risk minimized. So you put first your assessment, your classification, then you make the inventory, and then you plan for those types of equipment to be monitored and to ensure that preventive maintenance in place. So you could outsource your maintenance program to a private company, or you can over a time you can ensure that you have people in place who have the skills required to do such kind of programs. So definitely you need to ensure that you have a preventive plan, strategy and plan in place. You should have the tools necessary for that, to do that, and then you check with the supplying companies or then international records to know for particular equipments. Let's say for the ventilators, this requires to be inspected twice a year. So you put in place such kind of system to ensure that this piece of equipment is inspected twice a year, and there's a particular protocol for that available, and you assign an engineer to do that work. And then once this is done, you just put the date that this equipment was inspected, so that you ensure that those kind of equipment which are classified as high risk equipment are definitely within the preventive plan, that you ensure those are running functionally, and ensure that there's no, while in the ICU or other department they are using the equipment, there's no, you ensure that the safety of those equipment and you ensure the quality of those equipment. We go further into procurement. Actually, procurement is very a tricky issue, because definitely in our region, we just wait till the equipment is failed or not functioning, then we ask, oh, I don't have replacement for that equipment, so now I have to go and look for replacement. And when it comes to procurement, as you know, it takes time. It's not easy. So definitely procurement, when you talk about procurement, the first thing is to procure the right product of the right quality, with what we call the 5 rights. The right product of the right quality at the right price, of the right quantity, of the right place and time. And this is what we are always behind of, that we always wait till the end. So while managing those kind of medical devices, we have to be always proactive. We have always to look for things to improve or to be able to manage our equipment in the hospital, that those equipment will not break down, and even we have a replacement plan for those equipment. So you might consider when doing your inventory, you might consider that, or even procurement. So once you procure equipment, there are kinds of guidance for each piece of equipment. There is an age, or how we call it, a life age for those equipment. For particularly for, let's say, for ventilator, you might have between 8, the expected life for those equipment is between 8 to 10 years. So then you ensure that before that, if you are doing your preventive maintenance and you have a full functioning system in place, you ensure that before those equipment are reaching that age, that you have a replacement system in place to tackle those items, and then you try to purchase ahead of time those kind of equipment needed. So definitely, and then there will be issues of when you are purchasing kind of equipment, then you have to ensure that all those equipment, it's a new technology going to be in place, so that there's a need of technical services available. So you need to tackle issues of let's say, issues of let's say maintenance issues. Maybe the equipment is available at your hospital for more than, let's say, 10 or 15 years. So the company, they don't have spare parts for that. So then you are forced to, if the equipment break down, then you are forced to look for another replacement because there is no spare parts available in the market. So there are different criteria that you have to consider when purchasing equipment, particularly when it comes to the need of installation and training. And you always look to standardize your piece of equipment in a particular hospital. However, while doing standardization, you have to ensure that the price you are getting for that piece of equipment is reasonable, and you ensure that you put your own conditions so that the companies will not be able then to get benefit of that, and you are manipulated by the companies. So if we take this kind of SOP, standard operating procedure for replacement of equipment, there are different, this is kind of what we call cause and effect diagram. You will see that there are different elements affecting the decision taking to replace an equipment. As we said, first of all is the device age. So definitely you put in place your plan. You say for particular devices, I can wait because they are functioning, working well, so I can wait for those, I don't need to replace. But sometimes it's issues of spare parts, issues of reliability, issues of breakdown that force you to take such decisions. But definitely you have always to be, you have to put your plan ahead of time and to be proactive in this kind of decision. So always think about what is the cost-benefit ratio. If I'm having equipment running but the breakdown is too high, then I have to look how much I'm paying for that kind of repair. Definitely, if you don't have a system in place, like we call the CMMS, the Computerized Maintenance Management System, you're not able to tackle all those issues because then you have everything on paper, and sometimes those people are misplaced, so you're not able to catch those kind of information. So definitely the first thing that you have your inventory in place, you have a system or software in place to support you to take decisions. Decision for preventive maintenance, decision for procurement, decision for replacement. Those are necessary tools to ensure that whatever you are doing is based on data, and you can do your plan accordingly. And definitely you have to look on the high-risk devices. This will be our priority, to ensure whatever classified as high-risk devices are monitored and they are captured in our software, that we ensure that they are functioning and they're working well. This could be kind of tools for you as a department for biomedical engineering at a national level or even at regional level to think that, as we said, you are working, there are different stakeholders in this particular sector. So working in that particular department, you have to ensure that you have a good relation with the companies and vice versa, and that you're ensuring that you're getting full support, particularly for equipment purchased under category of high-risk equipment. So this could be kind of evaluation for the supplier that you share with the suppliers. So you do your evaluation and you share with the suppliers that in the past year, for us as department at the Ministry of Health in this country, we were highly satisfied with the service you provided, or we were disappointed. In this particular area, your team were not able to support us in terms of repairing the device. It took us too much time to get the spare parts. So all things have to be documented. So as I said, it's kind of to shift the thinking from doing things on papers and go to systemized and using softwares to ensure that whatever we are doing is captured, and we ensure that all information are put in that software or system, because it will help us at the end to pull out information and make decisions, and even it will support you in doing procurement, because while doing procurement you will be maybe asked, why did you go for X company and not Y company? So this kind of evaluation will also help you or assist you in your decision, because based on the previous experience, the last year experience, it has been shown that this particular company were failed to provide the needed services, whereas the other company were at the top. Regardless of, sometimes when you do procurement, many of decision making look on the price, and they don't consider the other elements needed. So usually it's not only the price, the only component, there's other elements also to be considered when doing procurement. And those tools can support you or assist you in making decisions, that you are fully supported with data that will help you to take correct and right decisions. And at the end, you have to protect yourself and not to be blamed to be taken wrong decisions. So you have the tools available that will assist you. So once you have a system running and functioning, so you will have for sure to control the inventory. This is the first part, to do the HTM, that you are controlling your inventory. And as I said, inventory is the first element to do the HTM. And to do that inventory, it's you to decide on which classification you want to actually to look at. You're going to look at first on the high-risk equipment, and once you have this fully covered, then you go to the medium level risk equipment, and so forth and so forth. And then you have to put in place a planned preventive maintenance, and then you look to the issues of procurement, and then definitely you look on issues of preventive maintenance and management of contract and services. And then you have to link whatever incidents is happening, you have to report on those incidents, and you have to ensure that somewhere within the hospital or the country there are regulatory people who can then put in place regulation that will address those kind of incidents, recalls or adverse reporting. And then you need to ensure that you are planning for your equipment ahead of time to be proactive in this kind of management, and not to wait at the end and then you look for actions, and always you are blamed that you are taking too long time to procure equipment and to ensure that you are doing the right thing on time. Definitely, when working in a hospital or a country or a Ministry of Health, you're always asked to provide reports, results. What was your impact? Sometimes we say, well, I have sent 5 people for training in this country, people were trained in that country on this piece of equipment. Fine, those are valuable things also, but I need indicators. I need things that you are able to report on. So this is the way of we have to shift thinking. How I'll be able to utilize the data I have to ensure that I can provide to the decision maker, to the minister, people information that they are valuable of. So one of those issues could be, if I have a system in place differently, then I have been able to ensure the downtime, that I can calculate how much I have piece of equipment not functioning over a period of time. So then I can look of issues of maybe staffing. Maybe I don't have the efficient staff or the skilled staff to do kind of maintenance. So this will be kind of indicator that I can go and seek support to hire more staff. This is one of the issues that I can go for and look for. Then I can, if I'm doing my inventory, then I can actually know how much piece of equipment I have in that hospital or in the country. And then if I include the cost of each piece of equipment, then at the end of the day, I'm able to report how much value of money I have equipment versus staff working in that domain. So this could be kind of element or could be kind of criteria that I can report and then seek support. And definitely there is issue of preventive maintenance compliance. If I have planned to do particular PPM for that piece of equipment 2 times a year or 1 time a year, then at the end of the year I'm going to go back and check on those data and to confirm of those who were complied or not implemented or not implemented. So this could be of complements how I'm doing the work, and then how many pending orders I have over a past of year, for particular days. Just to share with you an example, we did purchase for a country kind of CMS and to support them in their management. But after a while, after doing a lot of trainings, and after a while we want to check on the impact, we were actually disappointed to know that they are not willing to use such system, because for them the issue of pending orders is a big concern, because they have a lot of equipment not working, and by doing the CMS and putting the data inside the system, then they will be visible that those kind of orders are open for X days X days, could be one month or more, and then they will be blamed, or even they felt that there will be kind of criticism to them. So they felt to keep on working on the old system, it's better. So sometimes there's challenges that we have to face, but definitely we always need to go further looking how we're going to improve ourselves, because by doing that we are trying at the end to provide a high quality of services. On the other hand, how we'll be able to reduce the cost, because every kind of those, if you have a faulty equipment, then there's the issue of non-functioning health system, then the issue of that people are not getting the well-treated services. So all those issues have to be considered and tackled. This is also another example on the time needed in particular hospital that they have to monitor and to see what was the response time to respond to a faulty or pending order or job order. In some hospitals it's 24 hours. Then they look how much time it took us to allocate the spare parts. Was it available in stock? So all those kind of data, it's important that you are able to address and collect for you then to decide where the gaps, where I have to improve myself. Is it in terms of technical skills in my department? Is it from the companies who are failing to provide the required technical skills? So all those elements, is it issue of training? So all those issues have to be tackled and collected by you yourself. So while you're doing your job, you need to ensure that those data are collected. So at least then you are able to report to your director of the hospital or even to the minister on issues that you need direct implementation and improvement. And this is kind of what we call benchmarking. The most or two issues regarding benchmarking is the issue of costing and performance. So as I said, it's the issue of my team. So how much I'm costing as a department of biomedical engineering to the asset cost available in the hospital. So this kind of benchmarking I'm able to put forward to the director, just to show them the figure that I have, let's say, cost of $10 million worth of equipment, and how much cost is the people available to run those kind of services. Or in other countries, they go to check for the equipment service cost versus the acquisition cost. In some countries, they go, let's say that you have to have the equipment service cost to the acquisition cost almost equal or minus 7%, 10%. So for you also to look into that issue and to say, do I have such data? I'm able to, let's say, to compare myself with other countries,
to look what they are doing, and then I take from them, and then I do the same. So all those issues we need to understand that we want to improve our management, improve our work. So those issues can help us by doing that. Then also the downtime and the availability, to see how much really at my hospital, how much the time of the equipment are downtime, and how much percentage I have them available, working and functioning. So this could be the last example, just to show you that if we take the ICU ventilator, as we said, the inspection interval is 6 months, so, and the expected life is 10 years. So the mean time to repair is calculated at that hospital is 2.1 hours. And the inspection time is calculated at 1.1 hours. So for you, is those data, when collected, is just to compare yourself to other countries, to other hospitals. And then you see here the figures that you need. How much approximately is the service cost versus the acquisition cost. In some countries, it's 10%. It depends on the country. In other countries, can goes up to even 15 or 19%. It depends on the location, on the availability of service, or all those kind of issues have to be taken into consideration. And then for yourself, maybe you have to put your own data in terms of staff cost to run those kind of services. How many contracts I have with outsourced to companies? Then do I have the right space? Do I have the right transportation? Then all those elements you need to calculate and look for them. And unfortunately, a lot of our countries, they miss to use, or they miss to collect those data, and for various reasons. But once we are starting to do this, we're starting to put in place a system that when we are doing a job, we are ensuring that whatever is done is within a system to improve the health system and the health services. And definitely, at the end, working in a department at the hospital, for us to know if we are doing the job at a high level, we will ensure that there is satisfaction from the customer, particularly people working with us in the hospital, different departments, could be the ICU, the operating room, just for us to know where we failed and where we did well, so that we are able to improve our services. Maybe this could be kind of survey that support us to ask for training, particularly in our region, people working in the hospitals or even engineers working at the Ministry of Health. Maybe we are not well recognized in that such setup, and in particular countries, as I know, that they pay what they call risk fee in particular hospitals, whereas the engineers are excluded. They say because they claim this is only this kind of risk fee is paid for the physicians and paramedical, but your engineers are not part of that. So for at least once you are involved in doing or showing that you have a system in place, you are able to show your data, you are able to compare your data with other countries, then you can also use those tools to ask for training, to ask to improve yourself by doing even response, to ensure that we are responding to the queries or to the technical matters on quick and timely basis. So those are tools that you need to use, and you need to be prepared to be able to show to your directors or decision making. By this, I thank you, and thank you very much.